Welcome to the Kung Fu Mama Show. Today we have Peter Lapp, who is a postnatal personal trainer, and he's been training women for over 10 years in the Edinburgh area. Is that correct?
Edinburgh. It's close enough. It doesn't matter that much. It's all good.
Okay.
I still don't know how to properly pronounce Taipei, so there you go. It's all fair.
Oh my goodness. Okay, well, thank you for being on the show. It's so nice to have you here. How are you today?
Well, thanks for having me. I'm very, very well. It's a bright and cloudy morning up in Edinburgh, so it's nice to be up nice and early.
What time is it there?
It's 8 o'clock now.
Oh, so it's quite early for you.
Which is not that bad, to be fair, but I've been up for a few hours because we've got a couple of dogs to walk and all that sort of. So before I do anything in the morning, I have to get up 2 hours before that.
Wow.
I know.
So you
I'm
were
living
up
the
at
dream.
6.
Yeah.
Is that usual?
Pretty much, yes. 6 o'clock is the standard. If I want to do something at 8 o'clock, I have to get up at 6 o'clock.
Oh, okay. Okay.
The joys.
Wonderful. The joys. 6 o'clock for the dog. How many dogs do you have?
3.
3?
3 dogs at the moment. Yeah.
Oh my goodness. That's so amazing. So what made you want to become a postnatal expert?
Yeah, that's a good question. I started off training loads of younger women. When I became a PT, I used to have a proper job. I used to be a project manager and all that sort of boring stuff. And then I became a personal trainer. And I used to train a lot of younger women. And by younger, I mean 18 to 30-year-old.
Mm-hmm.
And one of my friends who was a PT, I've always been a prolific writer. So one of my writer friends in America was saying he kept losing all his clients. Because they started having babies and then he couldn't train them anymore because he wasn't qualified. And I thought, well, that seems a very silly way to lose people that want to keep training with you, that like training with you, but can't because you don't have the qualifications for it. So I went to get the qualifications and I noticed that there wasn't really anybody else doing it at the time because this is quite a while ago. And before you know it, I became like the go-to postnatal personal trainer in Edinburgh. And then it was like the go-to in Scotland and all that sort of stuff because I just kept writing about it. Mm-hmm. And like I said, most women over the course of the last 10 years, women have gotten a lot more information about postnatal issues. But 10 years ago, nobody really knew anything about things like Diastasis Recti, pelvic girdle pain, pelvic floor problems. These were all just things that you might have as someone who's given birth or as a mom, but you kept quiet about it because they were just mommy issues.
Right. I mean, you're just taking care of the baby. You probably have these problems, but you don't really know how to address them.
Yes, exactly. And they become, I mean, you've probably heard for Diastasis Recti, they call it mommy tummy quite often. Mm-hmm. And 10 years ago, that was just the price you paid for having a baby. And some women were lucky and they had a flat stomach, and some women still looked 9 months pregnant, even though they'd given birth 5 years ago. And it was just, but they had 1 or 2 kids to show for it. That was the price you paid. And it wasn't really that recognized as a medical condition. It was more looked at as an aesthetic thing, as in you look a certain way, but it wasn't linked to things like postnatal back pain or posture problems or pelvic floor weakness and all that sort of stuff.
Wow. So can you explain a little bit more about what is Diastasis Recti?
Yeah, sure. So lots of people pronounce this differently. Diastasis Recti, Diastasis Recti, whatever you want to call it. It's basically separation of the stomach muscles along the line that your belly button sits on. Mm-hmm. So basically, I'll just move up a bit. That straight line here, that line, the muscles there move apart a little bit when you're pregnant. So this happens in pregnancy is the most common. Sometimes it happens to men as well, and it can happen to women who've never given birth or who've never been pregnant. But pregnancy does seem to be the most common cause of it. And it's basically to make room for the baby, the belly has to get bigger.
Okay.
right? And so therefore, the six-pack muscles, they kind of move apart a little bit. So they go from here to go to there. And that line just gets a bit bigger along the line of the belly button. And that is, if you look at the narrow definition, I call it, of diastasis recti. So if you look at purely the medical one, that is usually what they say, it's separation of the stomach muscles along that line.
Okay.
And
this happens during the pregnancy.
Yes. So what you'll find is actually, a lot of people think that this happens postpartum, but it's actually during the pregnancy and fairly early on during the pregnancy that this starts to happen. Basically, the moment you start to show is the moment this starts to happen. So they found that there was a study done published in the British Journal of Sports Medicine quite a while ago now, to be fair, 2016, I think it was. And that showed that 33% of women have this about 3 months post prenatal. So when they're pregnant, 3 months in, they have this. 60%, it's 6 months, and almost everybody has this on their due date. Which makes sense because you need space for a larger baby at that stage.
Right.
And then postpartum, so after you've given birth, 60 to 80% of women still have this 6 weeks postpartum, and 30% of women have this a year postpartum.
Wow, 60 to 80%.
60 to 80% still 6 weeks, and that is only the narrow definition. So that is only the widening of the muscles and them not being back together. So when I talk about the narrow definition a lot, that is just the width of the gap. You might have read up about that you measure that by sticking the finger in along that line and all that sort of stuff. And the more fingers you can put in there, the worse your diastasis is.
Okay. And what is the most narrow, like if you can have your finger in there, then that's already diastasis recti.
It is,
right?
Well, basically, yes, but no. This is, and I hate to be annoyed about it. It's in the medical definition, anything below 2.5 centimeters is not classed as diastasis recti. And the reason for that is that even you always have that gap there. I mean, you're a martial artist, right?
Yes.
So you've trained like a machine for years and years, and at one stage you probably had abs showing. Maybe you still do. Maybe you're still completely ripped. Well, there are 6-pack abs, so there's always a line in the middle.
Right.
That has always been there because you have your left side muscles, your right side muscles.
Correct.
The thing that nobody really knows prenatal, because no one measures it, is what the width of the gap between those two muscles are.
Right.
If you know what I mean, how deep is that line? For some women, it's a bit wider than it is for others because nobody's exactly the same.
Yes. So to scientifically know, you would have to have done it before you got pregnant, and then after, right?
Exactly. Yes. Okay. Exactly. And no one measures that because it's not a thing, right? Yeah. Prenatal. It just doesn't exist. And like I said, that is just the width of the gap. We now know that to measure it correctly, there's the depth of the gap also matters because that is to do with the connective tissue between those two muscles. Because prenatal, you can probably put your finger there and you would feel quite a bit of resistance. That you wouldn't be able to put your finger all the way through, for instance. With postnatal, some women can do that because that connective tissue between the muscles, that sheet, has just been stretched too far, like a balloon would stretch. And when you deflate a balloon, it's never quite a new balloon anymore.
Right, correct.
And then on top of that, we have muscle functionality that then becomes addition. This is why I always say diastasis recti affects pretty much everybody who's ever been pregnant. Because for 9 months, or at least 6 months, you've had quite a bit of weight, quite a bit of constant pressure sitting on things like your pelvic floor, on your muscles, and certain muscles start switching off a bit during pregnancy.
Switching off as in
they're not functioning in the same way that you want them to function prenatal. And especially if you look at things like your glutes, so the muscles in your bum, because your center of gravity shifts quite often during pregnancy, depending on how big you get, you can have that pregnancy waddle, right? When you get really big, that you almost walk like a duck a little bit.
Right.
And your glutes, actually, your center of gravity shifts forward. So this could be your normal posture, and you kind of move like this a bit. You start leaning through it a bit. And that means your glutes need to activate properly again, and all that sort of stuff.
Right. Exactly. So, how many? So you already said 60 to 80% of women are already affected by this.
Yes.
And, I guess if you hadn't already measured yourself before, would you still be able to diagnose yourself? Say, for example, would I be able to diagnose myself right now? I'm already 4.5 months post-pregnancy. So how would I know if I have?
Basically, the easiest way to do it, and there's loads of videos on how to do this on YouTube. I always recommend people, of course, look at mine, but what can you do? Basically, if you
guys, check out Peter Lapp's YouTube channel here.
Check out the Healthy Postnatal Body YouTube channel. But it's basically, if you lie on your back and you relax and you put a finger, say, an inch or two above your belly button, and then you raise your head, and you can see if you can either put your finger through it, and you can feel your belly muscles grabbing your finger in the same way that your baby would. It's a very similar feeling that you put your finger in there, and if you can feel the little squeeze, then you know that is your point. If you can't feel the squeeze, that's okay. Just put an extra finger beside it, and again, if you then feel the squeeze, then that is how wide your diastasis recti is. What I always tell people to do is then get a measuring tape and measure just how wide your fingers are, especially if somebody else does this. In the UK, you get your 6 weeks postpartum checkup by the GP, usually, and they should technically do it. But chances are that your GP's fingers are a different size than yours.
Yes.
So to measure, so sometimes I've had clients come to me, and I've had people come to me saying, I was 2 fingers, I had 2 fingers separation, 6 weeks postpartum during my checkup, and I'm 4 fingers now. So what happened? 4 fingers at 5 months. Did it get that much worse? And I said, probably not. Your GP just had sausage fingers. They just have much thicker fingers than you do. And therefore, when they tell you a finger is not a measurement, is what I always say.
Right.
Whenever you've had to measure anything in the house, you never said, that's about 2 fingers, and then you go to the store. And so you have to measure it properly and get a bit of a tape measure.
Okay, so usually once you've measured it, or what do you do? So if you do have a certain width, what is the way to treat it? Or does it need to be treated?
Yeah, it does, because it's going to bite you in the bum a little bit later on if you don't. Especially if you find that you have, I always say, everybody has diastasis recti after their first pregnancy as well.
Okay.
Everybody does. And that's important, because what I hear quite often is women say, I never had it after my first, but after my second, it was really, really bad. They had doming of the stomach, they had a much rounder stomach after the second, and then after the third, they're like, I now need surgery, which they quite often don't, but that is what they think they do. Because there's a lot of information online about surgery and tummy tucks and all that sort of stuff. So if I say, so after your first, about 6 weeks postpartum, you can start doing some sort of diastasis recti exercises. And diastasis recti exercises, although it's a core condition, a condition around the core muscles, it's not the standard core exercises that you might do prenatal, like in the gym. They're not crunches, they're not full of planks and Russian twists and all that sort of twisting motion, cool stuff. You start off very gently, because the first 4 to 6 weeks of any good postpartum training program is about activating the right muscles. Okay. Making sure everything works in the right order. Okay. So that means getting those glutes fired up that I spoke about, just getting your TVA, which are like small muscles, your transverse abdominis muscles, all fired up, and just making sure everything works properly. And then after 4 to 6 weeks, you kind of start strengthening up those muscles.
Can
And
you
then
give us some examples of some exercises that you would do within the
Sure.
4 to 6 weeks that would
So
use
the
those
first,
muscles?
of course, the first 4 to 6 weeks, we do things like heel slides. So where you just lie on the floor on your back and you move, you bend your leg and then straighten your leg out whilst keeping it off the floor, just trying to keep tension on your stomach. So very gentle. Things like glute bridges. So where you just lie on your back and you squeeze your bum on the way up. Things like squats, things like reverse lunges. So all those muscles, all those exercises really focus on the glutes a lot more. And then you add some oblique exercises. So what I always like to do is add like a side plank with some dips and all that. Just a short one. And you just move side to side so you can feel those muscles in your side squeeze a bit. And of course, like I said, there's tons of postnatal programs out there. My own, I do like 3 months of free a free trial for my own, and that again gives people a chance to completely recover that. But if they want to check it out, I can send you, if you have a website, I can send you the first 4 weeks and just throw it up on your website, and then people can, or throw it in the podcast description, whatever. More than happy to.
That would be great. So basically the first 4 to 6 weeks, they're more sort of like very much, would you say they're more like resistance exercises?
Yeah, everything is resistance exercises. There's no such thing as, because it's fundamentally, it's a muscular problem. And the only way to deal with muscular problems is by doing resistance exercises.
Okay.
Cardiovascular exercises don't really help other than with the heart and the lungs. So walking and all that sort of stuff, which is quite often recommended for women, or what loads of people, especially people like to jog and like to run. They like to get back into running as soon as possible. That is useful for many things, but it's not going to help any sort of pelvic floor or diastasis recti sort of related issues. So it's all resistance-based stuff.
So do you have patients that come to you at 4 to 6 weeks and they already have this problem?
Oh yes, I have a lot. I have people that come to me quite often. A lot of people come to me before they give before they give birth. Sorry, so they send me an email saying, "I'm going to give birth 3 months from now. Can you book me in?" Because in Edinburgh, I'm quite busy, and there's only so many physical hours in the day, right? I can only do like 6 hours of PT a day. After that, I'm tired.
For sure.
And I have some people that come to me 20 years postpartum that say, my doctor told me I had this, and my doctor gave me your number. Can you help me out here?
Oh,
because fundamentally it's a muscular issue. And that means it can almost always be resolved by exercise. That's a brilliant thing. You can never be too late trying to get this sorted. Amazing.
So how long is it a natural process to heal from diastasis recti, or you have to do these exercises to be able to heal from it? And how long does the process take?
That's an excellent question, because what you see a lot of the time are women that naturally bounce back. Is quite often what they call it. And it's usually seen as they have a flat stomach again, and therefore they have bounced back postnatal, or the weight came off quickly and therefore they have bounced back to their prenatal look. Diastasis recti never really heals itself because it's a muscular problem, and we kind of accept that any sort of muscular issues need a bit of work.
Right.
To help. You need a bit of rehab. If I have a shoulder problem and my shoulder hurts, that doesn't ever go away without me putting some effort into it. So what I would do is go to a shoulder rehab guy or girl, and they have me do some exercises.
Right.
And I get my mobility back and I get my strength back, and then my shoulder is fine again. Diastasis recti is very similar to that.
Okay.
It is basically just a straightforward muscular problem that can be fixed.
So after you've done these exercises, the gap will start closing, or the muscles will learn to work function the way they used to? Is that sort of how it works?
That is 100% correct. Yeah, the muscles will start to, when the muscles remember how they should be working. I mean, I'm oversimplifying this a little bit, but as if they have a brain. But when the muscles start working properly again, they will move back into position. Because everybody's muscles should be in a certain place. If the muscles don't work, they might be in a different one, or they might be slightly out of position. So when they all work properly and they strengthen up, the gap automatically closes, muscle functionality improves, and quite often the depth of the gap also gets less. And therefore, that's when you know, when everything works properly again, that's when you know you don't have diastasis recti anymore.
How do you know if everything's working properly? Is it just because you would like know your own body, or there's like actually a certain measure?
There are certain things. That's a good question. Again, there are certain things you should be able to do. The problem is, especially what I come across here, and I'm not sure what it's like where you are, but most people have no idea how their body should be functioning.
Yeah,
again, because you're a martial artist, you're much more in tune with how things should feel when you move.
Yeah, exactly.
We have gotten pretty terrible at recognizing how things should feel when we move, and the things that make us feel good. Just because we sit down all day, we're sitting in an office and we switch off and we focus on other things. So we tend to do, when we do exercises, and of course when you're training and you do katas and all that sort of stuff, it's all about move this way in order to get there. It's not just about do this 10 times, kick 10 times, and it doesn't matter how you flail your leg out, we'll still count it as a good kick, right? Whereas, so a lot of exercise we tend to count repetitions. So what I do is I tell people, do 10 squats, and they just move up and down 10 times without realizing which muscles they're using, whether the muscles are working in the right order, and whether they're in control of their muscles or not.
100% agree with you. I love that you're saying this.
Yeah, it's a huge problem. It's a massive problem, because it means that we can't really be relied on to decide for ourselves when it's sorted, because we don't really know. So that's just why I always say that it's better to have at least some sort of guide, at least somebody who can, whether that's online or whether that's in real life, just someone who can say, listen, these are the cues, these are the things you have to look out for.
And that being said, you have to be careful about what online sources you're going to.
Oh, absolutely. Yes, only work with experts is what I always say. There's a really big trend in the UK right now, and I see this online, is to ask the patients what their solution is, so to speak, is what I always call it. To ask other people who have gone through the same thing how they fixed it, and then trust their answer implicitly. So that means that you look online and you see someone else who's gone through the same, or says they have gone through the same thing as you. You can't check their credentials, you just have to believe them, and then just do what they think works for them. Whereas I think this is a medical condition, so you ask people that have studied this stuff, that really know what they're talking about. And you see this a lot on support forums. That's why this is why I always say, don't ask the patients. If I break my leg, I'm not going to insist that my doctor has also had a broken leg and fix it. I just want the guy who went to medical school, or a woman who went to medical school, that can say, this is how we fix a leg. I don't need his or her life story to match mine.
Okay.
If that makes
sense.
If that makes sense. So, you know, if you always work with, and I've seen this once or twice, where especially with weight loss people, so it's easier to give the example with weight loss, when people say, this worked for me, I worked with somebody and this worked for me. I would say, yeah, okay, but give me the number of the person you worked with. Because that's the person who got you the result. It's not what you did that necessarily works for me, because everybody's slightly different. As in, your physique is completely different from your neighbors, from anybody else who's given birth. And therefore, by definition, you cannot always apply the same solution to these things.
I see. So we kind of went on a bit of a tangent because I wanted to know.
About that.
No, that's great because I mean I think that's great information and we should always trust the experts. But I did wanted to know after the 6 weeks, you know, what's the next stage? I know we kind of switch gears. Yeah.
So for the first 4 to 6 weeks, it's about muscle activation. And then it's about strengthening up the muscles. And that's, again, it's another 4-week sort of stage. So if we're talking recently postpartum, so you're saying you're 4.5 months, right? So, I mean, that is very recently postpartum. So 6 weeks postpartum, after 6 weeks, you can kind of start exercising again. Technically, after 2 weeks, you can start doing your pelvic floor exercises.
Right.
But it just depends on what you do in the meantime. 6 weeks postpartum, you can start this sort of exercise. And that means that then 12 weeks later, you're ready to strengthen the muscles up. So 12 weeks postpartum, you're ready to strengthen the muscles up.
Wait, so between 6 to 12 weeks, there's another type of exercise past the resistance?
Yeah, so after like 4 weeks of doing these exercises, you switch up.
Okay.
Simply because, again, for any sort of muscular training, you need progression in there. You need to make it more and more difficult. Otherwise, you keep doing the same thing, right? And your muscles don't get stronger. They just get used to doing the same thing. So every 4 weeks, you kind of need to mix it up. So the focus changes because after 6 weeks of doing these exercises, your muscles are all working the way they should. Then we just need a bit of strength in there. And that takes about 4 weeks.
And how do you add what's an example of strength exercises you would do after 6 weeks?
Yeah, so then we add things like resistance band glute kicks. So we add resistance to it. So what I use, I like the resistance bands a lot. Just the short loop ones or the longer ones, because they're cheapest chips. You can take them anywhere.
Exactly.
And they last a long, long time. They're not going to gather dust like a kettlebell would, or that would be used as a doorstop after about week 2, right? And when you buy them, they're anywhere between, I don't know, £6, $10, something like that. So they're not too expensive, and you get a whole set of them.
Right.
So you don't have to buy a whole set of dumbbells or a whole set of kettlebells. So then you start looking at things like resistance band glute kicks, resistance band. I do a lot of back flies because we start to work on your posture a little bit. I don't know if you felt this, but when you're just postpartum and the muscles in your back get a bit weaker, they get stretched a lot. You might be breastfeeding and leaning over a lot and all this sort of stuff. So we need to pull that stuff back a bit, right?
Yeah.
So all the sort of resistance band T's, resistance band Y's, so you move that rows, just anything to stretch the muscles in the front and strengthen the muscles in the back. To push your nice back, get your posture back. Again, if you have nice posture, your core will be much more active as well and will be much more engaged. So all these exercises, though they don't necessarily target those core muscles directly, they all indirectly really, really help the core.
Great.
And by doing that, it means your lower back pain will be less and all that sort of stuff.
So tell us a little bit about, can these exercises be also used for pelvic floor?
Yeah, awesome. It's slightly different for the pelvic floor. So for the pelvic floor, what I always recommend, and it depends on what your postpartum situation is a little bit. I know that some people they sit like they do things like sitting the month and all that sort of stuff. I don't know if a lot of your listeners do that.
Yes.
So during that 30-day period, or if you have twins, it's slightly longer, 50 days or 55, or however long it is, you're not really supposed to do this. So I'll just say that if you are for pelvic floor exercises, once you are ready, you can do things like your Kegel exercises and all that sort of stuff. Kegels are so remarkably important to do for everybody postpartum.
Okay.
As I know for a lot of women, the tendency tends to be, I don't have any bladder weakness, as in I don't leak or I don't pee myself or anything like that. And therefore I don't need to do them. But the pelvic floor is such a complicated area, such a complicated group of muscles, that if you start working on strengthening that up, that will really help later on when you're ready to move into things like Diastasis Recti exercises and core exercises, because everything in the body is connected. Absolutely everything. I mean, like the song goes, right? The knee bone's connected to the hip bone and all that sort of stuff. The same goes for muscles.
Right.
So what I come across a lot is people that say, okay, I have core issues, and I have pain in my sacroiliac joint, so in my pelvic region at the front or at the back, just depending where your pain sits, pelvic girdle pain and all that sort of stuff. And I then find out that it's all connected to a weak pelvic floor.
I see.
So strengthening your pelvic floor up helps massively. I would always recommend, if you have access to one, see a pelvic floor specialist for at least one appointment. Just make an appointment with a pelvic floor physio, and that is usually, again, 6 to 8 weeks postpartum. So you could have already started up your pelvic floor exercises, your Kegel exercises, and you can find how to do them anywhere online. There isn't really a bad source of information for Kegel exercises, because it's just one kind of exercise. You Google Kegel and it comes right up, and you can't really get that wrong. And then you just book in, if you have access to one, with a pelvic floor specialist. It's a personal trainer can't do these examinations simply because it's quite let's say invasive. It's an uncomfortable examination for a lot of
So
people.
you have to go to your gynecologist too.
Yeah, your gynecologist will do it, or just any women's health physio will do it. But again, make sure they specialize in what they do. A general physio might well know how to do it, but they are much more familiar with things like knee pain and things like shoulder pain and back pain. And therefore, I always say you work with a specialist. It's a complicated neck of the woods, the whole pelvic region. There's like 200 odd muscles in there that all work together, and that should all work nicely together. So you really want to work with someone who knows what they're looking for there.
I wanted to know if there's a difference between having a C-section and having a natural birth for, on these different cases.
Yeah, no, that's a good point, because a lot of women think that just because they've had a C-section, they're not going to have diastasis recti or pelvic floor issues. They just believe that because the doctor cut through the layers, that's what's caused the damage. The damage, and I'm going to say damage, it sounds a lot more drastic than it actually is. This is a completely natural thing, and like I said, can always be resolved, right? In very, very rare cases, it might not be ideal and might need a bit of medical intervention like surgery, but in most cases, these are just things that can be resolved. We just call it damage because that is just the language we use. The damage happens during pregnancy, not during labor. And that is a really important point, because the damage has already been caused. Like I said, 33% of women have diastasis recti at 3 months, and 60% have it at 6 months pregnancy, 6 months gestation. So you already have it. So the fact then that somebody adds a scar, so to speak, that makes it a bit more difficult. So you want to be a little bit more careful, because your healing process from a C-section is slightly different.
Would you say that the exercises for Diastasis Recti and those for after C-section they're still the same?
Yes, fundamentally. The only thing that changes a little bit, and this is why my program splits up after 3 or 4 months, it splits up into different sections, is where your diastasis recti is. Because your gap could be above your belly button, it could be below your belly button, or it could be all the way along the line. And that kind of determines what the solution is. For C-section, the only thing you have to bear in mind is that the scar takes a lot longer to heal than you think it does, as in than you see it does.
Yes.
Right. So
I'm dealing with that right now because
yes.
for the first baby, you always compare, right? So the first
Mhm.
baby, the scar, I felt like it held, it healed quite quickly. After 1 month, I didn't really feel anything,
Yeah.
any problems. But for the second baby, I was still feeling sometimes, even now, I still feel some, sharp random pains, or I have no idea what, basically. And I just find it so surprising that I can still feel these things, whereas the first baby, I didn't feel that. So
Yeah. And that's a huge thing. And this is why for C-section clients, I always recommend they do some sort of scar tissue massage themselves. You can do that yourself, right? Just start gently massaging the scar. You use a bit of oil, and you can use baby oil for this if you want to, and just put that on, start gently massaging. It keeps the tissue a bit more supple, a bit more flexible, and it stops the tissue tightening up too much. It stimulates blood flow and all that sort of stuff, which we know stimulates recovery, right? Because blood flow helps with that.
Right.
But yes, it's completely normal for, or at least I get a lot of women coming to me saying, I still get 4 months postpartum. I still get. It's not like a stitch, but it almost feels like a stitch that you have when you're running. You just feel like, that sort of just a little niggle. It's normal, but I always say just because it's common doesn't mean it's right.
Okay, I see.
Right. So it will go away, but also you can help it along a bit by just performing some C-section tissue massage. And again, you can Google that, and you can't really get that wrong as long as you're just gentle with it.
Okay. And so that comes to the question is, how long do you wait until you want to get your body back to normal?
The body back to normal question. This is the standard one. I'm always very clear about this. There is no body back to normal anymore postpartum.
Okay.
Isn't. You have given birth.
Boom.
It always changes things. I know, and it's a bugger. You can still look phenomenal. You can still be stronger than you ever were. You can be more flexible than you ever were. You can be an absolute machine. You can do all the things you used to do and better.
Right.
But there is no body going back to a previous state. If I break my leg, and my leg heals, and I do all the exercises, and I'm stronger than ever, my leg will never be quite the same again.
Okay, got you.
Right? And that is the thing. That doesn't mean there's always going to be a weakness. It is not that next time you have a baby, the same thing will happen again, like you're experiencing with the twins. Right. Every pregnancy is different, and every postpartum issue is different.
That's great.
Are you getting ready to say bye-bye to them? Are you ready to hand her off?
Oh, I'm surprised that the gang has not come back to interrupt us yet. But yeah, she's antsy, so I was just picking her up to be, so she can.
Oh no! It's just she's ridiculously cute. But fundamentally, there is no going back to the old way, and that's okay. Yeah. The old way wasn't the best way. It was, the old body wasn't your best body. Like we were discussing earlier, most people had no idea how their muscles were supposed to feel prenatal.
Right.
And all of a sudden, postnatal, if you do the right exercises, you know how your body should feel. And you're probably working muscles that you never worked before. And you're strengthening up muscles that you never strengthened up before. So you're moving better, you're stronger, you're fitter. You Wonderful. Just also happen to have a baby on top of that.
That's right.
Right? So that's a pretty good deal.
Yeah, it's empowering.
You're not giving anything up.
That's right.
You're not giving anything up. So bouncing back, there is no going back. Looking back is always a bad way to look, I think, because it implies that was better. And I always like giving the example of Jessica Ennis-Hill. She's a heptathlete. She won gold at the London 2012 Olympics. And then she had a baby and she came back in Rio 2016 and she got silver, which is phenomenal, right? It was like a year or a year and a half after giving birth. I mean, that's Olympic level athletes can still perform at that level and get medals postpartum. So that means that all that stuff is possible postpartum. So there is no reason at all to want to go back to previously. You can be completely badass postpartum.
Wonderful. And on that note, thank you so much for giving us all this wonderful information. How can our
thanks
listeners...
for having me. It's awesome.
Yeah, how can our listeners find you?
If you look for healthypostnatalbody.com, you will find me online. My little podcast is also called the Healthy Postnatal Body Podcast. And what I do is I just answer emails from listeners. That's pretty much all I do on the podcast. I get people ask me questions. I don't sell you anything. I just say, this is what the information is.
Great.
And that's where you can find me.
Okay. Thank you so much. And guys, don't forget to follow at Kung Fu Mama Show, Facebook, IG, and our YouTube channel starring Sarah Chang. Woohoo! Thank you.
Bye, everybody.
Bye-bye.